Hi, and welcome to Commissioner's Corner. I'm your host, Lois Leonard, and thanks for joining us today. Recently, we've had discussions with directors from the Boston Public Health Commission, the Office for Immigrant Advancement, and the Mayor's Office of Recovery Services. Today, we have the pleasure to meet with the Chief of Health and Human Services, Marty Martinez, whose job is to oversee all these departments, as well as a few others. Welcome to the show, Chief Martinez.
Thanks for having me.
You're a busy man.
Absolutely. Some exciting things, but yeah, busy for sure.
Well, we appreciate you joining us, and maybe we should start by trying to explain to our viewers just how your role within the HHS cabinet works.
Yeah, absolutely. So as the Chief of Health and Human Services, I oversee roughly 8 different departments in partnership with an amazing set of leadership, department heads, staff. It's the largest cabinet in city government. And it includes such exciting programs from Immigrant Advancement, Public Health Commission, Recovery Services. And so it's really important work. I mean, I would suggest it is the core of the web of social services that the city provides and partners with. But it's an exciting place to sort of work, an exciting place to sort of elevate some really important things happening in the city.
Well, I think we have a lot to talk about.
We do.
Okay, so in addition to the offices that we've already mentioned, you oversee the mayor's mentoring movement, the Boston Center for Youth and Families, Veteran Services, Disability Commission, the Office of Fair Housing and Equity, and the Office of Food Access. Where do we start? But why don't you tell us what is the common thread that runs through all of these departments?
Yeah, the common thread is really, these are the departments that are serving the communities who need it the most. I mean, it's really serving, lots of times we talk about vulnerable populations, folks most in need. We would suggest in Health and Human Services, it's really, you know, we've talked a lot about trying to get people into the middle class. Before you get people into the middle class, it's really about how do you give them those basic services they might need, the supports they need, access to resources. So really it's helping people not only get by, but we see it more about helping people thrive. And ensuring that the different populations that we're targeting have the supports they need, but also people understand kind of what resources are there and where there's gaps. And so for us, it's really trying to make sure those gaps get filled, and I think it's a core piece of city government.
Well, do you think other cities put as much emphasis as Boston does on these programs?
Yeah, I mean, most big urban cities have a lot of these programs and departments, but I think one of the unique things is Mayor Walsh has been so committed to ensuring that the resources for Health and Human Services are there to support the community. I mean, he's really said, listen, this isn't just other stuff we do, this is core to what we do as city government. So not only has he emphasized it throughout the administration, but he's also ensured that we're elevating many of the issues we need to, especially given some of the changes in the federal government and things that are happening on that front. These services are really important at the city level, and so that's what's critical.
You mentioned the federal government. That brings to mind the Office of Advancement of Immigrants.
Yeah.
What is the most recent news that you can share?
Yeah, what is not the most recent news, right? I mean, there's always something happening on the federal place. I think in terms of the Office of Immigrant Advancement, it's really working right now to respond to some of the federal policy changes. So TPS and other areas where people are being sort of forced to deal with immigration issues that they hadn't been forced to deal with before. One's even focused on the public charge, which is really about who qualifies for access public services and goods, and some of those changes and restrictions coming from the federal government. We're already seeing on the local level people not signing up for benefits or being concerned about their immigration status in terms of working with the criminal justice system or accessing resources through school and education. So the Mayor's Office of Immigrant Advancement has really been working to make sure the community understands we protect them, we support them, but we need to advocate to the federal government, which has been a huge piece for the mayor as well. So as you can imagine, every day it's about responding to issues, but also we want to make sure we're bringing the mayor's pro-immigrant, you know, proactive message to the community so people feel safe and they have a champion at City Hall.
Right. Okay, let's talk about food access.
Okay. Yeah, absolutely. So food access, you know, the Mayor's Office of Food Access is really focused on improving access to high quality food, but not only in the sense of how do we make sure that there's great farmers markets and there's great nutritional food in the schools, which is really important in partnership with BPS, but also how do we make sure people understand how critically important access to healthy food is,
Education.
Right? Education, awareness building. You know, recently the Greater Boston Food Bank just released a report that said the cost of hunger in Massachusetts is over $2 billion. I mean, think about that for a second. $2 billion in loss, you know, loss attainment of young people's educational values, in medical services, special education. if you're hungry, you can't learn. If you're hungry, you can't work. If you're hungry, thinking about those basic things, you have a tough time thinking about other resources you may need. So
and if you're hungry, it leads to
everything
illnesses.
else. Absolutely. And if you don't have the income to get healthy food, then sometimes you might buy unhealthy food, which leads to diabetes and sort of the other behavioral issues.
So how do we help the low income access healthy foods?
Yeah, part of it is leveling the playing field and making sure if you qualify for SNAP or public access benefits around food, nutritional programming, that you get it, right? There's a lot of people who qualify who don't sign up, and so we do a lot to make sure people know what they qualify for.
So again, it comes down to public awareness, and knowing and less confusion about what's out there.
Yeah, absolutely. I think public awareness, and I also think the mayor has said this time and time again, understanding a basic necessity that people need to live, which is food, and knowing that many families struggle with it, and that hunger is an issue that we have to work at every day. So it is not only building awareness, but it's making sure that there's gaps in the community, that we're creating programs to fill those gaps. So the Mayor's Office of Food Access is really invested in it and really trying to push the needle and make sure everybody understands how important it is.
Sure, and I think some people are in denial and even acknowledging that it exists in our neighbor.
Yeah, our neighbor, or we think, oh, that's people who are dealing with hunger, or those kinds of people.
Right.
So I'll tell you that our community health centers are a great example that we partner with the Health Commission. Almost every community health center has a food pantry. And 20 years ago, that wasn't the case. And they have them now, not just because it's a good idea, they have them now because people need them. People are coming to appointments where, oh, we don't know where we're going to eat today. We don't know what our next meal is going to be.
By having a food pantry in every neighborhood, it also involves the whole community because it has become a very common event that everybody can be involved in together to support and raise awareness.
Yep, and understand, how do I get involved? You can donate food, you can get engaged, you can encourage your grocery stores to get more involved.
Sure.
So
which they are.
Which they are. They're actually doing some great things. But I think it's an important piece, and I'm not sure that we think enough about it. And so, one of the things I'll just share with you, one of the pushes around for advocacy is the notion that when you go to the doctors, no matter what you're going to the doctors for, and no matter where you live, you should be checked for food insecurity. Your doctor should be asking you about your food, about your access to healthy food. Rarely does that happen, and if it does happen, it only happens in low-income neighborhoods only. But it really, the rate of food insecurity is high in neighborhoods you would be surprised at. And so it's an important thing that the office works on.
Veteran Services.
Yeah.
Another department that you're in charge of.
It's huge. Yeah, and there's great work happening there. Commissioner Sterling and her team do some really great work, and there's a program that they launched in partnership with the city, or with the mayor's office, called Operation Thank a Vet. And we just had this past weekend, there was one of our annual, multiple times a year when it happens, where we go door to door and we thank veterans for their service. And it's not only to say thank you and to make sure they're appreciated, but it's also to connect them to resources and opportunities. Those who might need financial assistance, job training, or they're struggling with housing. It's really incredibly valuable.
I'm hearing a lot of common words: housing, training. It's
absolutely. It's sort of that thread of how do we make sure people have what they need, not only to, again, and I say this a lot, not just to get by and to survive, but to thrive, right? It's not just the basics. It's, okay, you need employment, you need skill building, you need job training. So it's really important work that the Veterans Commission is doing. And again, it's not only public awareness, as you said, but it's also making sure that if there's gaps in services, that we try to fill them as a city.
Well, I know that you've spent a lot of your career here in Boston and in Massachusetts supporting mentoring programs. Can you maybe tell us a little bit about why you think those programs are so important?
Yeah, I mean, I think they're so important because the question is, I think for all of us, no matter how old we are, we had relationships that helped us get to where we're at.
Sure.
Helped us navigate the good times and take advantage of stuff and kind of overcome the challenges and bad times. And so the relationships, developmental relationships for all people, mentoring relationships is critical. And so I've invested my entire career in it up to this point and still do it today. It's a key part of with the Boston Centers for Youth and Families, thinking about engaging mentors in community centers and adults. It's also a huge initiative that the mayor launched called the Mayor's Mentoring Movement, which we launched several years ago, which was really about making sure all Bostonian young people have the mentors and relationships in their life to be successful. I sort of see the work and as leveling the playing field. For some youth, they have those relationships at home, they have them in school, or they have them through extracurricular, and some youth don't have them. And so it's how do we make sure they have the right supports to be able to have those relationships help them get what they're trying to accomplish.
But as busy as you are, how do you find the time and the motivation to continue to volunteer for something like this?
I just think I couldn't do my work if I didn't still have that connection, right? So right now, for example, every Wednesday, I go to the Burke in the morning before this workday starts and connect with my student that I work with, that I've been working with. I've been doing this for 4 years there. And we spend time talking about school and class and jobs and, building that connection. So maybe later in the day when I have a meeting with a hospital CEO or with the mayor, I have his words in my head, a young man who lives in Roxbury, struggling with a lot of different things, but making amazing strides.
Inspiring.
He's making me better at what I need to do,
Yeah.
so it's pretty valuable.
So if someone is interested and has never mentored before, what's
Yeah.
the first step? How would they go about volunteering?
Yeah, so we have a great partnership with the CBO, an organization I used to run, and they're doing amazing work called Mass Mentoring. And so at massmentors.org, there's a list of a bunch of programs all over Boston, and really connected to the Mayor's Mentoring Movement and bostonmentors.org. They're all kind of interconnected, but you can go and see some of the places that the mayor's invested in and that you can get involved in too.
And well worth the effort.
Absolutely. You'll get more out of it than the student does at the end of the day.
Well, while we're talking about our young population, let's talk about the Boston Centers for Youth and Families, the BCYF. Tell us about the Super Teen program that exists.
So the Super Teen program is really intended for those young adults who are not old enough to get a job. And so it's really saying, we know that you're too old to go to a summer camp for kids, but you're not yet legally old enough to get a job at a park or a grocery store or whatever. So there's about 250 slots already filled up. They filled up very quickly because it's a population that needs support. There's a wait list already, but these young people will get enrichment programs, they'll get engagement in activities through the summer, and then if they complete the full summer, I think it's a 7-week program, they end up getting a stipend. So they also do get some money at the end. But it's a great program that acknowledges, we know that you don't want to be in a YMCA camp because you feel like you're too old for that. But we want to get you ready to enter the youth jobs program.
Right, and create some work ethics as
absolutely.
they get ready for those years to come.
Well,
unfortunately, this summer is filled. Maybe there's a wait list.
There is a wait list, and we encourage you to check out BCYF sites. I mean, there's over 20 across the city that have different versions of these programs. And there might even be some pieces at some of those centers individually. But go to boston.gov and you'll be able to access the center website.
And get ready for next year. Maybe you have a 12-year-old at home.
Right. Who's like, this is my last year. This is my last year of my camp program. I'm ready for a job. And it really does. It's a nice fit to feed into what ultimately is, we employ with private partners almost 11,000 teens through the summer. So this is a nice launching pad to sort of that.
And become involved and get to know more about the city's efforts.
Absolutely.
Well, we recently also had the pleasure of talking with the director of the Mayor's Office of Recovery Services. We were speaking with Jennifer Tracy. And we were updated on the many programs and all the good work that they're doing there. They're also helping to shape policies. What can the average resident do to help your efforts?
I think the Office of Recovery Services is a really critically important obviously department, first in the kind of its in the nation, created at the municipal level. And I think the number one reason it was created, it was not only to break down barriers, create more access to services, but to focus on what that individual person can do, which is getting rid of anything that creates stigma for people. I mean, addiction and the path of recovery is negatively impacted by stigma all the time. Meaning, how do we talk about people dealing with substance use? It's a disorder, it's a disease. How do we talk about it as opposed to an addict who's got a problem, who's creating these issues through their behavior? It's how do we think about it? How do we talk about it? Rather than methadone mile, it's recovery row, right? How do we think about what we say when we think of people who are dealing with the disease. And that's really what it is when people have an addiction and they need treatment and in the path to recovery. So the average person can, really think about what's happening in their neighborhood and their community. Almost every health center, CBO, hospital has some program targeting people in addiction and recovery. And primarily because we're sort of at an epidemic place right now. We're definitely in a spot where the rate of use and addiction is really dangerous.
Yes.
And I think people figuring out how to get involved in their own neighborhoods and in their own communities, that's one of the first places to sort of get involved and engage.
You speak about language. So something as simple as using the term, calling someone an addict. That simply is a great place to start, is to not use that kind of language.
To not use that kind of language, and to also think about what does it mean.
And what would you use?
So we talk about somebody having a disorder or having a disease, right? I mean, so that's what it's about, right? It's you're have an illness and you're not well and you need treatment, you need support. Addict focuses on your behavior and that it's your fault. And once you get an addiction, unfortunately, it's so much out of your control. And that we need to create this wraparound services and resources to do it. But I don't need to tell you that, and I'm sure this was mentioned through Jen Tracy, the mayor has said, we're committed to this. We're going to do everything we can do to create resources, opportunities, be creative. We're going to rebuild the Long Island Bridge to create more recovery opportunities back again on the island. The city's a strong leader in this, and we're going to keep doing it and help people get the resources they need.
Terrific. Okay, and I'm sure we'll be talking more about
that
together.
Absolutely.
Well, like I said, we were coming up with a lot of common words here throughout our discussion today. So some of your departments share these common issues. How do your departments intersect, and how do they work together at times to come up with solutions?
Yeah, I mean, I think it's really about who we serve and who we want to get the word out to, right? So there's lots of targets. One target is the actual individuals, right? So if it's the commission that's focused on the elderly, how are they targeting elders who need supports, or immigrant advancement, or people with disabilities, or veterans? They're individual targeted populations. But the theme is really, we want to break down any barriers to accessing services that anyone has. We want to make sure that people who have particular needs get their needs met. And then the other theme is we want the world to know, stakeholders, policymakers, funders in the private sector, that we need to give resources and supports to people in need in our community, and that the city will take a leadership role, but we need you to be in partnership with us.
Right.
So it's really about how do we ensure that we're helping people thrive in all places, right? Whether it's young to older, more experienced, whether it's people dealing with different illnesses or challenges through the Health Commission. It really is making sure that people have what they need to truly have a healthy community in the broadest sense, not just the physical health, but getting what you need to make it. So that's really how they cut across. And I've only been here, I guess it's 4 months. But what I'll say is I think our departments do an amazing job and can only do even more work to kind of break down silos that exist and ensure that people get their needs met.
Communication.
Absolutely.
Amongst everyone. Right?
Yeah.
You mentioned the elderly, a growing population here in the city of Boston, as is everywhere.
Yeah.
How are you addressing these needs?
Yeah, it's good. The commission does a great job with Commissioner Shea, and really ensuring that that the elderly have access to the services they need, whether it's nutritional programs, whether it's connecting them to opportunities and resources to get benefits need, transportation, whatever it might be. They're really working to ensure that people have those resources. One of the things they're really doing that's exciting is thinking about kind of an aging-friendly city. And so they're thinking bigger than just services and resources, but how we make sure that all elderly, as folks are getting older in the community, understand where are the businesses that want them to go to? Where are the resources in the community centers? So there's this age-friendly plan that's very broad, but it's about making sure that Boston is really a place where you can age in a way where you're welcomed and supported. And so the commission does some really amazing work around it, and is only going to continue to grow given the aging population that we have.
Right. Well, you're also overseeing the Boston's Disabilities Commission.
Yeah.
Well, I understand that they are doing a disability access survey of
Yeah,
sorts?
they're doing a survey to sort of ask people, what do you need? What are your needs?
Oh.
What are the challenges? I mean, recently they did a transportation summit, so people could talk about, you know, issues that we may not deal with, issues I don't deal with. When I order an Uber, I'm not thinking about, is this Uber app or whatever going to be accessible for me? But
Right.
when you're living with a disability that might impact your mobility, you have to think about that. And so the survey is really intended to learn more from folks about what they're trying to what's struggling them in their lives, and it's the ability for the commission to collect the data and then figure out, are there gaps, are there programs we need to do, more advocacy. There's a link that you can go to on the city website to access the survey, but it's meant to really bring in a lot of information and help us elevate the needs in the community.
So somebody can go online and anybody.
Yeah, anyone can go online
fill it
and you
out
can fill it out for yourself. You could fill it out for your parent or your child or whatever. So yeah, it's a good opportunity to sort of let us know what's going on.
We've talked about so many things
We have.
today, and I mean, the wheels are spinning.
Yeah.
There's so much that needs to be done
Yeah.
in our world, and so much that we can do ourselves. Your offices are doing some incredibly important work.
Yeah, absolutely. They are. I mean, they are. I say it every day when I sit with my cabinet colleagues that are doing great work too, but I always say we're the most important cabinet in the city because we are for some people the place where their voice has to get heard or their needs need to get met or we need to step into them to make sure in the community the advocacy is there so that they get what they need. So it's so critically important, and I tell you every day when we're thinking about the issues that challenge us, and we think about the issues that challenge the mayor about the city, a large chunk of it lives with the great work that the departments are doing to make sure people have what they need, again, to thrive. I want to keep going back to that thriving
I'm with
place.
you. All right.
That's where we're at.
Well,
So,
thank you
yeah,
so much for
absolutely.
speaking with us. I'm sure we'll keep us updated.
Yep.
Come back and talk to us again.
Love to.
Your departments are doing such great hard work
Yep.
to make our city stronger, and we're greatly appreciative
Thanks,
of
appreciate it so
everything.
much. Thank you.
Well, Boston is strong, but it's only as strong as its weakest link. And our city recognizes this as they focus on promoting the health and well-being of our most vulnerable. The departments that we discussed today also need your individual support. If you have comments or concerns, you're welcome to send an email to Chief Martinez at marty.martinez@boston.gov. And we'll continue to keep you updated on the city's progress right here on Commissioner's Corner. I'm Lois Leonard, and I look forward to our next conversation together.